The number of malaria cases around the world has plateaued after several years of steady decline. This has led the World Health Organization to call for a new global response to the disease. The organization released a report on Monday stating that 219 million cases of malaria had been reported last year. That's compared to 217 million in 2016. Beryl Ooro reports.
After years of steady decline, annual rates of the mosquito-borne disease have leveled off according to the World Health Organization's 2018 report. It says the only solution is to focus on the countries hardest hit by the disease, most of which are in Africa. Although scientists are working on vaccines and ways to control mosquito numbers, preventative measures aren't working fast enough.
The question to us is, how do we get back on track to meet those targets? And this is what WHO, in collaboration with partners across the world, is launching a response that we have called From High Burden to High Impact, putting the focus on the highest burden countries, helping them get back on track by the four key elements: political leadership, the use of all information to better target the response, improving our normative work, and most importantly, coordinating all partners around a national plan, a nationally owned and developed plan.
There's some good news though. Countries with fewer than 10,000 cases of malaria are now within reach of eliminating the disease completely. India recorded a 24% reduction in malaria cases in 2017, and Rwanda saw a 436,000 drop. The WHO needs to get back on track quickly if it's to meet its target of reducing disease and mortality rates by 40% by 2020. Beryl Ooro, CGTN.
Well, for more on this, we're joined in the studio by Edward Mwangi. He is the CEO of Kenya NGOs Alliance Against Malaria. Thank you very much for joining us. Now, the WHO says there were 3.5 million more malaria cases in 2017 in 10 African nations than in 2016. The continent, it seems it is carrying 90% of the burden of this disease. Why do you think that is?
Thank you so much. Malaria is a disease of the poor, and basically it happens where there is nothing else. And as such, if you look at the topography of Africa, we have deserts, we have a lot of free range where mosquitoes are easy to breed. That comes with a cost of having malaria. At the children, pregnant women, and people who cannot be able to afford health care, who are based in those terrains, then they are affected most. More so, especially the pregnant women, when they are about to give birth, you find that it can result even to abortion or miscarriage. Or in an event where the birth occurs, those children are usually they are not the weight that is required for babies. Yeah.
Well, as we know, governments in Africa are facing competing health and other development priorities. What do you think leaders should do to focus on this problem of malaria?
Malaria, being the disease of the poor, as I've said, basically affect the community, the people who don't have the voice. And this is where the governments come in, because nobody will talk for those poor, vulnerable population. And it's upon them to be able to make sound investment decisions, human rights in terms of reaching to those people who cannot afford medication.
Yes, yeah. So as you say, it is the poor and the vulnerable that suffer mostly. There are some positive signs, though. For instance, a lot of people are sleeping under insecticide-treated nets. So that's a positive aspect. And there are other advances, aren't there? What more can you tell us about other things that are being done?
There is a lot of good things that are happening in malaria. Over the last 10, 20 years, we have seen tremendous decrease of malaria cases and deaths in that case. And what that happens to be is that more people are living to see their potential. However, at the end of the day is that A lot of tools have been developed. These tools include bed nets, treatments, diagnostics that are effective. And currently, most of the tools that are available are effective and are working, except in the Asia region where we have resistance to treatment. However, there are a lot of work that is going on to address that resistance. We are hoping that that won't find its way to Africa like the previous regime of the treatment that was rendered could not work because of the resistance. So we are hoping going forward that we'll be having minimal treatment to be able to treat even the resistant malaria. And more so when you come to prevention, there are new emerging issues like insecticide resistance. We have mosquitoes not responding to the bed nets, and a lot of work has been going into that. And we are hoping that coming days we'll have new solutions, new tools that will be able to do that. However, what we are saying is that the current tools, they are working, and we should take this opportunity to make tremendous gains against malaria, because if we are not able to make with the current tools, the new tools still will not be able to do more.
Okay, thank you very much. We'll have to leave it there. That was Edward Mwangi, CEO of Kenya NGOs Alliance Against Malaria. Thank you very much.